Hello, everybody. Today I would like to talk to you about an important health concern that doesn't always make the headlines, but this is one that affects millions of people around the world. This topic is toxoplasmosis. This is a microscopic parasite known as Toxoplasma gondii. Now, that name might sound complicated to you, and the disease might not be as well known as something like the flu or COVID-19. But toxoplasmosis is surprisingly common. In fact, experts say that 1 in 3 people around the world have been infected with this without them even knowing. Let's start with what toxoplasmosis is. Toxoplasmosis is an infection caused by a protozoan parasite. This means that it is a tiny, single-celled organism that survives by living inside of other living creatures. This parasite has a unique life cycle, and it has figured out how to live in a wide range of warm-blooded animals. This includes humans. However, there is only one species in which Toxoplasma gondii can reproduce sexually. This is cats. So how does this parasite infect humans? There are several ways that a person can become infected with toxoplasmosis. One of the most well-known is direct or indirect contact with cat feces. For example, if you clean a litter box without properly washing your hands afterwards, or just not washing your hands afterwards, or if you're in the garden and the soil that has been contaminated with this cat feces, the parasite can enter your body. Even inhaling particles of dried litter can potentially cause an infection. Another common source of infection is eating undercooked or raw meats, especially pork, lamb, or wild game. Animals that are infected with Toxoplasma gondii can have tiny cysts of the parasite in their muscles. And whenever we eat this meat that hasn't been cooked properly or safe to a safe temperature, we can ingest those cysts. You can also get infected from contaminated food or water, or from unwashed fruits and vegetables, or by using kitchen utensils that have caught or that have been in contact with raw meat and were not properly cleaned afterwards. There are also more rare cases, such as organ transplantation or blood transfusion from an infected donor, or transmission from a mother to baby during pregnancy is also another very common mode of transportation. And that brings me to one of the most important parts of this talk: who is most at risk? Well, most people with toxoplasmosis don't show symptoms, and they may never realize that they were infected with this. There are three key groups of people who are at greater risk of serious complications. The first one being pregnant women. If a woman becomes infected for the first time during pregnancy, there is a risk that the infection will pass to her unborn baby. This can cause congenital toxoplasmosis, which may lead to miscarriage, a stillbirth, or birth defects such as brain damage, seizures, or visual problems later in life. People with weakened immune systems is up next. This includes individuals living with HIV or AIDS. They need to be careful because with their immune system being weakened, it's an easier way for the disease to enter their body and infect them. People who are also undergoing chemotherapy, or people who have recently had organ transplants and are taking immunosuppressive drugs also need to be careful with this. In these cases, the bodies may not be able to fight the infection efficiently, allowing the parasite to cause serious damage to the brain, eyes, and other organs. Third, we have the infants who are infected in the womb. This goes hand in hand with pregnant women with the same um, potential side effects. Babies who are infected before birth may not show symptoms at first, but the effects can develop months or even years later, including developmental delays, hearing loss, or permanent eye damage. Up next, we have the signs and symptoms accompanied with toxoplasmosis. For most healthy people, the symptoms are very mild and resemble the common flu. You might experience fever, headache, muscle aches, skin rash, and swollen lymph nodes that may last for weeks. Um, Another common side effect may include your eyes and visual loss, blurriness, just common eye problems that you may not have had before you get infected with this disease. These symptoms can be permanent or they can last several weeks before going away on their own. Because they are so general, some people chalk them up to a cold or a seasonal virus. In more serious cases, especially in high-risk groups, the infection can lead to neurological problems, lung issues, or eye infections. The eye condition known as ocular toxoplasmosis can cause blurry vision, pain, and in some cases, even blindness if it is not treated. Treatment and prevention. If a doctor suspects that you have been infected with toxoplasmosis, especially in someone at risk, they may order blood tests to check for antibodies. In certain cases, imaging testing like MRIs or eye exams may also be needed. If you do have toxoplasmosis and you are in good health, you might not need any treatment at all. Excuse me. However, people who are pregnant or immunocompromised will usually be prescribed antiparasitic medications, such as pyrimethamine and sulfadiazine, often along with folinic acid to reduce side effects. These medications don't necessarily kill the parasite completely, but they often help control the infection by keeping it from reducing and spreading in the body. So, how to prevent toxoplasmosis? The good news is this is largely preventable. Here, yeah, here are some of the most effective steps that you can take. You can cook your meat very thoroughly by using a food thermometer to ensure that the meat reaches a safe temperature before eating. Wash your fruits and vegetables before cooking or eating them. Even if they do look clean, just be safe with it. Avoid drinking untreated water, especially if you are in traveling or in rural areas this will mainly apply to. Wear gloves while gardening and wash your hands afterwards. Avoid handling cat litter if you are pregnant or immunocompromised. If you must, wear gloves and wash your hands well. Clean kitchen surfaces and utensils after they come in contact with raw meat, and wash your hands frequently, especially before eating or preparing any food. And if you do own a cat, don't panic. You don't need to get rid of your pet. Just take precautions. Feed your cat commercial food, not raw meat. Keep them indoors if possible to reduce their risk of catching infected prey or have someone else clean the litter box if you fall in the category of someone who is at a higher risk. So, in conclusion, toxoplasmosis is a common but overlooked infection. For most people, it causes no serious harm, but those in vulnerable groups, like pregnant women or people with weakened immune systems, it can be life-altering or even life-threatening. The best defense is awareness and prevention. With good hygiene, safe handling, and a few simple precautions, we can significantly reduce the risk of infection. So next time you see a cute cat video or dig into a rare steak, just remember, there's a hidden parasite out there that we can manage with the right knowledge and the right care. Thank you for listening and take care of yourselves.